So today we are taking 6 decisive actions, guided by gold standard science and the week 1 executive order from President Trump to protect children from chemical and surgical mutilation. This morning I signed a declaration: sex-rejecting procedures are neither safe nor effective treatment for children with gender dysphoria. These procedures fail to meet professionally recognized standards of care. Medical professionals or entities providing sex-rejecting procedures to children are out of compliance with these standards of health care. This declaration is a clear directive to providers to follow the science and the overwhelming body of evidence that these procedures hurt.
So you watched that and you felt the ground shift beneath you, because this is precisely the moment that Hannah Arendt warned us about when she wrote about the banality of evil, when administrative mechanisms become instruments of systematic oppression dressed in the antiseptic language of bureaucratic propriety. And you heard Robert F. Kennedy Jr., the man who spent his career peddling conspiracy theories about vaccines, now occupying the highest health office in this nation, declaring war not on disease, not on suffering, but on vulnerable children, on transgender youth, who are already navigating a society that wants them erased. And this is happening right now today, December 18, 2025. And if you think this is just about healthcare policy, then you haven't been paying attention, because this is the latest in a string of actions by President Donald Trump's administration that target transgender people, including eliminating mention of trans people on federal websites, halting data collection on health issues, removing trans people from the military, and suing states that allow trans athletes to play on high school sports teams. And we are witnessing nothing short of a coordinated federal assault on an entire community's right to exist. Kennedy stood there with the audacity to invoke science, to invoke something he called gold standard science, when major mainstream medical associations, including the American Medical Association, the American Psychiatric Association, the Endocrine Society, the American Psychological Association, the American Academy of Pediatrics, and the American Academy of Child and Adolescent Psychiatry, have supported such care and agree that it's the gold standard of clinically appropriate care that can provide life-saving treatment for children and adults. And here's what should terrify you beyond the immediate cruelty, beyond the calculated suffering this administration is inflicting, because new proposed rules would prohibit hospitals from participating in Medicare and Medicaid if they provide care such as puberty blockers and surgeries for transgender minors, and would prevent federal coverage of such treatments. And do you understand the mechanism at work here? Do you grasp the sheer totalitarian genius of this maneuver? Because virtually every hospital in the country takes Medicare, which covers older Americans and the disabled. Which means this isn't just about denying care to trans youth. This is about holding every hospital in America hostage, forcing them to choose between serving their elderly patients, their disabled patients, and providing evidence-based care to transgender adolescents. The language Kennedy deployed should make your blood run cold, because he called this chemical and surgical mutilation. He called evidence-based medical care supported by decades of research and every major medical organization in this country malpractice. And this is the deliberate dehumanizing rhetoric that always precedes state-sanctioned violence against marginalized populations. And we have seen this script before in history, when governments declare certain bodies to be inherently disordered, when they position medical intervention as harm rather than care, when they elevate ideological purity over scientific consensus. And you want to know what's even more insidious here? Because the legislative package included a bill introduced by Rep. Marjorie Taylor Greene Arga that makes it a crime to provide gender-affirming care to transgender minors, punishable by a fine or prison time of up to 10 years. And it passed on Wednesday, which means doctors, physicians who dedicate their lives to healing could face a decade in prison for providing care that every major medical association endorses. Now let's talk about what Kennedy and this administration are actually citing when they claim to be following the science, because HHS leaders on Thursday cited their own review of evidence and reports from other countries, many of which have faced sharp criticism for drawing sweeping conclusions with little or poor evidence. And this is crucial because they're weaponizing European policy changes that are themselves deeply contested and often rooted more in political pressure than medical evidence. And yes, some European countries have adopted more restrictive approaches, but 2/3 of EU countries still allow trans youth at least some access to puberty blockers. And in March, medical organizations in Germany, Austria, and Switzerland reaffirmed access to gender care for minors. And the notion that Europe has uniformly rejected gender-affirming care is a right-wing fabrication, a deliberate distortion, designed to provide international cover for domestic oppression. And here's what we need to understand about the actual medical evidence, because in recent years, a medium-term study up to 6 years and several shorter-term studies have demonstrated the positive and potentially life-saving impact of gender-affirming medical care for TGD youth, and a recent study from the Trevor Project shows that transgender youth with access to hormone replacement therapy medications have lower rates of depression and are at a lower risk for suicide. And when we talk about suicide risk, we're not being hyperbolic. We're talking about actual children, actual adolescents who are statistically significantly more likely to die by suicide when denied access to affirming care. And this administration knows this, Kennedy knows this, and they're proceeding anyway, which raises the uncomfortable but necessary question of whether this is merely callous indifference, or something far more sinister, a deliberate effort to make life unlivable for transgender youth. The timing here is also critical, and we cannot ignore the broader political context because the pivot to the topic of transgender minors comes one day after Republicans in the House of Representatives passed a package of healthcare bills that do not extend subsidies for people who buy health insurance in Affordable Care Act plans, which means while Republicans are manufacturing moral panic around gender-affirming care, they're simultaneously letting healthcare subsidies expire for millions of Americans. And this is the culture war playbook in its most naked form: distract the public with manufactured outrage about transgender children, while quietly dismantling the social safety net while transferring wealth upward, while consolidating power. And it works because instead of discussing why healthcare costs are bankrupting families or why insulin prices remain unconscionable, we're debating whether transgender children deserve to exist. But let's be absolutely clear about what Kennedy is proposing, because supporters and opponents of transgender rights agree that taken together, the forthcoming hospital rules could make access to pediatric gender-affirming care across the country extremely difficult, if not impossible, and the care is already banned in 27 states, so this is a nationwide ban implemented through administrative coercion, through the manipulation of funding mechanisms that hospitals depend on for their survival. Dr. Susan Cressley, the president of the American Academy of Pediatrics, said allowing the government to determine which patient groups deserve care sets a dangerous precedent, and children and families will bear the consequences, and patients, their families, and their physicians, not politicians or government officials, should be the ones to make decisions together about what care is best for them. And this is the fundamental principle at stake here: the sanctity of the physician-patient relationship, the notion that medical decisions should be made by doctors and families based on evidence and individual circumstances, not dictated by ideologues in Washington. And we need to talk about who this actually impacts, because there's this pernicious myth circulating in right-wing media that thousands of children are being rushed into irreversible surgeries, that there's some kind of transgender industrial complex pushing medical intervention on confused kids. In one study that conducted a retrospective chart review of a U.S. national pediatric surgical database, authors were only able to identify 108 trans minors who had received any form of gender-affirming surgery over 4 years, 2018 to 2021, accounting for 0.04% of all transgender youth nationwide, and only 10 of these patients were under the age of 16, and approximately 95% of these surgeries were chest surgeries, which means the scenario Republicans are describing where prepubescent children are getting genital surgery simply doesn't exist in any meaningful way, and what does exist is a careful, deliberate process involving mental health professionals, endocrinologists, families, and the young people themselves, making informed decisions over extended periods of time. Kennedy also claimed that these procedures hurt, not help children, which is a lie. It's a demonstrable, empirically falsifiable lie, because a large body of medical literature demonstrates that with support at home, school, and in the community, and with access to gender-affirming care, transgender youth do as well on mental health measures as their non-transgender peers, and this higher suicide risk is not unavoidably associated with transgender or non-binary status, but instead is the result of stigma, discrimination, and mistreatment, which means the harm isn't coming from the medical care. The harm is coming from people like Kennedy, from administrations like this one, that tell transgender youth that their identities are invalid, that their bodies are sites of mutilation, that they don't deserve to exist. Now I want you to think about what this means in practice, because in July the federal government began investigating providers across the country, resulting in more than 20 hospitals, including those in liberal cities such as Los Angeles and Boston, rolling back or ending their gender-affirming care programs for minors and some young adults, and the environment has led some trans adults and families with trans children to leave the country, And we're talking about American families fleeing America, seeking refuge in other nations because they cannot access basic health care, and one mother from Texas, whose daughter had been receiving care, described it as life or death for her family, and they actually left the United States because of this administration's policies. And when refugees are created by healthcare policy, when families are forced into exile because they cannot access medical care, that's not governance, that's persecution. The broader implications here extend far beyond the transgender community, though obviously that community bears the immediate and most devastating impact, because when government can declare certain medical procedures to be categorically illegitimate, when political appointees can override the consensus of every major medical organization, when federal funding can be weaponized to force hospitals to deny care, then no one's healthcare is safe, and medical groups denounce the announcements, saying they intrude on physician-patient relationships and jeopardize care for everyone. Because today it's transgender youth, tomorrow it could be reproductive health care, or end-of-life care, or any medical intervention that runs afoul of whatever ideological orthodoxy dominates Washington. And this is how authoritarianism works, incrementally categorically eliminating the autonomy of marginalized groups first, and then expanding that logic to encompass wider and wider swaths of the population. And we have to name what's happening here, because this is part of a systematic implementation of Project 2025, that dystopian blueprint for Christian nationalist governance that Trump pretended to disavow during the campaign. More than 75% of proposed policies in Project 2025, pertaining to the limitation of LGBTQ freedoms, have been implemented by the Trump administration, and this includes eliminating legal recognition of gender identity, redefining sex as a fixed biological binary, ending data collection, would allow us to even understand health disparities in LGBTQ communities, and it's all unfolding exactly as the architects of Project 2025 intended, and everyone who said we were being alarmist, everyone who said Trump wouldn't actually implement these policies, everyone who claimed both sides were equally bad, owes the transgender community an apology. Not that apologies will restore access to care or undo the trauma, or bring back the lives that will inevitably be lost. The scientific dishonesty of this administration is particularly galling, because Kennedy and Dr. Oz, yes, that Dr. Oz, the television personality who's now administering Medicare and Medicaid, stand there invoking evidence while systematically ignoring or distorting what the evidence actually shows. National Institutes of Health Director, Dr. Jay Bhattacharya, said the research agency will end support for research into gender transition, saying it was junk science to begin with. So they're not only denying care, they're shutting down the research that could further establish the efficacy and refine the protocols, and this is the move of people who know they can't win on evidence, so they simply declare evidence itself to be ideologically compromised and eliminate the possibility of future evidence that might contradict their predetermined conclusions. Let's also be clear about the class dimensions of this policy, because Medicaid serves low-income Americans, disproportionately people of color, disproportionately people in states that have already banned gender-affirming care. The first would prohibit doctors and hospitals from receiving federal Medicaid reimbursement for gender-affirming care provided to transgender patients younger than age 18, which means wealthy families will still find ways to access care. They'll travel to other countries, they'll pay out of pocket, they'll navigate the system, but poor families, working-class families, families in rural areas, families in red states, those families will have no options, and their children will suffer, and some of them will die. And this administration knows this, and proceeds anyway, which tells you everything you need to know about whose lives they value, and whose lives they consider expendable. The constitutional implications here are also staggering, because Chase Strangio, co-director of the ACLU's LGBTQ and HIV Rights Project, said these gratuitous proposals are cruel and unconstitutional attacks on the rights of transgender youth and their families, and the American Civil Liberties Union has announced plans to sue to stop the rules, and there will be litigation. There will be years of court battles, and in the meantime, children will be denied care, families will be torn apart, lives will be destroyed, and even if the courts eventually strike this down, the damage will have been done, and that's part of the strategy too, because cruelty is the point, the suffering is the point, sending a message to transgender people that they are not welcome, that their existence is contested, that their very survival depends on the whims of whoever happens to control the federal bureaucracy. And I need you to understand that this is not happening in isolation. This is coordinated across multiple federal agencies, because Kennedy made this announcement alongside Dr. Oz at CMS and U.S. Food and Drug Administration Commissioner Dr. Marty Makary said the agency is sending warning letters to 12 makers and sellers of breast binders who marketed or sold the devices for treatment of gender dysphoria in children. So the FDA is going after medical devices, the NIH is ending research, funding CMS is cutting off hospital reimbursements, HHS is issuing declarations of malpractice, and this is what total governmental mobilization against a minority population looks like. And the fact that it's being implemented through bureaucratic mechanisms, through regulatory changes, through funding restrictions, rather than through explicit legislation makes it no less a form of state violence. We also need to reckon with the historical parallels here because every time a government has declared certain bodies to be disordered, certain identities to be pathological, certain medical interventions to be mutilation, it has ended in atrocity, and I'm not being hyperbolic. The Nazis burned the Institute for Sexualwissenschaft, the pioneering gender clinic in Berlin in 1933, they destroyed decades of research and drove transgender people underground, and many to their deaths, and while we're obviously not there yet, the trajectory is clear, the rhetoric is clear, the humanization is clear, and the fact that this is being done under the banner of protecting children, when actual medical professionals, the people who dedicate their lives to child welfare, are screaming that this will harm children, tells you that child welfare was never the actual concern. The testimony from families is gutting, because one mother whose transgender daughter is receiving care said for our family, and for Parker in particular, this is life or death. And when parents are telling you that access to this care means their children will live, and denial of this care means their children might die, you don't get to dismiss that as hysteria. You don't get to claim you're protecting children while ignoring the actual parents of actual transgender children who are begging you to let them access care. Health officials said Thursday they expect to emphasize psychosocial assessment and support for transgender youth, including compassionate developmentally appropriate counseling, but they acknowledge there are a limited number of mental health care providers available, so their alternative to medical intervention is therapy, except they're not actually funding therapy, they're not expanding access to mental health services, they're just eliminating medical options and calling it compassion. The implications for medical autonomy writ large cannot be overstated because if the government can categorically ban a medical intervention that every major medical association supports based purely on ideological grounds, then medical practice ceases to be guided by evidence and becomes subject to political control, and every major medical association in the United States recognizes the medical necessity of transition-related care for improving the physical and mental health of transgender people. And that consensus means something, or it should mean something. And when political appointees can simply declare that consensus to be ideologically motivated or captured by activists and override it with administrative fiat, then science itself becomes subordinate to power. Kennedy said during the press conference, if people sue us, they're welcome to, which is the statement of someone who knows they're on shaky legal ground but doesn't care, because the process is the punishment. The years of litigation, the uncertainty, the chilling effect on providers who might preemptively stop offering care, rather than risk federal investigation. All of that serves the administration's goals, even if they ultimately lose in court. And this is a feature, not a bug, of authoritarian governance, where the law becomes a weapon, the bureaucracy becomes an instrument of oppression, and the suffering inflicted during the interim is dismissed as unfortunate but necessary. We're also watching in real time the collapse of institutional credibility, because when HHS can release a report claiming gender-affirming care is harmful and dangerous, while the report said it was peer-reviewed with Stat News, reporting that affirming reviewers were never contacted about their research being cited, while most reviewers have been outspoken critics of gender-affirming care, are affiliated with anti-LGBTQ groups, and have little to no experience providing clinical care for young trans people, and the American Oncological Association responded to the report noting its underlying methodology lacks sufficient transparency and clarity for its findings to be taken at face value, and key elements including literature selection criteria, analytical frameworks, and justification for excluding other studies, and key findings in studies on which the report relies are either underexplained or absent, and as a result the report's claims fall short of the standard. Then we're not operating in the realm of science, we're operating in the realm of propaganda dressed in the language of objectivity. And let's talk about what happens next, because the proposed rules will be entered into the Federal Register on Friday, and that starts a 60-day comment period, and the rules would not take effect immediately, which means there's a window here. There's an opportunity for mass mobilization, for public comment, for legal challenges, for civil disobedience, and the public will have 60 days to comment on these rules beginning tomorrow, and HRC is encouraging members, supporters, and LGBTQ allies to submit comments, and every single person watching this who believes in bodily autonomy, in medical freedom, in the basic right of families to make healthcare decisions, needs to submit comments, needs to contact their representatives, needs to support organizations like the ACLU, like HRC, like the Trevor Project that are fighting this. But we also need to be realistic about what we're facing, because the Supreme Court already ruled against transgender rights in the Scarametti case on June 18, 2025. The U.S. Supreme Court issued a devastating ruling in U.S. v. Scarametti, upholding Tennessee's ban on affirming healthcare treatments for transgender youth, and by deciding that SB 1 is constitutional, the Supreme Court has made it more difficult to challenge similar laws in the 27 other states where such laws are currently in effect, which means the federal judiciary, the institution that's supposed to serve as a check on majoritarian tyranny, has largely abandoned transgender people, and with a 6-3 conservative supermajority that's unlikely to change anytime soon, which means the political battle, the cultural battle, the fight for hearts and minds becomes even more critical. This is also fundamentally about who gets to bot the science, who gets to claim expertise, who gets to determine what counts as legitimate medical practice. And Kennedy, a man with no medical degree, who's spent decades promoting vaccine skepticism and conspiracy theories, now sits atop the nation's health apparatus, declaring that decades of research and clinical practice constitute junk science, and every medical professional in this country should be terrified, because if they can do this to gender-affirming care, they can do it to anything. They can declare climate science to be politically motivated, they can dismiss public health interventions as government overreach, they can subordinate medicine to ideology completely. The families who are living through this, who are watching their children suffer, who are contemplating whether to flee their own country, deserve more than our sympathy. They deserve our solidarity. They deserve our resistance. They deserve a society that actually values their children's lives. And right now the federal government of the United States is telling transgender youth that they don't deserve to exist, that their bodies are wrong, that accessing care makes them complicit in their own mutilation, and the psychological damage of that messaging, the internalized shame, the heightened dysphoria, the increased suicide risk, all of that is a feature of this policy, not a bug, because the goal isn't to protect children, the goal is to make being transgender so difficult, so dangerous, so stigmatized, that people simply stop being visibly trans, and we cannot separate this from the broader fascist trajectory of this administration. Because when you eliminate minority populations from public life, when you erase them from government databases, when you ban them from military service, when you deny them health care, when you threaten their doctors with prison, when you force families into exile, are implementing what scholars of authoritarianism call social death, the systematic elimination of a group's ability to participate in civic life and history, shows us very clearly where this leads, and anyone who's paying attention, anyone who's not willfully naive, understands that we are on a very dangerous path. The moral clarity here should be absolute, because we're talking about children, we're talking about adolescents navigating puberty, navigating identity formation, navigating a society that often treats them with hostility, and they need support, they need affirming care, they need to know that their lives have value, and instead this administration is telling them that they're disordered, that their identities are illegitimate, that accessing care constitutes mutilation, and the Pediatric Endocrine Society cautioned legislators that support and implementation of these bills will worsen mental health, increase the risk of suicide, and contribute to poorer overall health in TGD patients. And when the actual experts, the people who treat these patients, are telling you this will increase suicide, you don't get to claim you're protecting children. So what do we do? Because despair is not a strategy, and resignation is complicity, and the forces arrayed against transgender rights are powerful, but they're not omnipotent, and there are things that can be done and must be done. And first we fight these rules through every available legal mechanism. We flood the comment period. We support litigation. We pressure Congress. We make this politically costly. And second, we build mutual aid networks, because if hospitals are going to be coerced into denying care, then communities need to create alternatives, underground railroads to states or countries where care remains accessible, funding for families who need to travel, support for providers willing to risk their licenses. And third, we tell the truth relentlessly, because the right wing has built this campaign on lies and distortions, and the systematic misrepresentation of medical evidence, and we counter that, with facts, with testimony from families, with the voices of transgender people themselves, and most fundamentally we refuse to accept the premise that certain people's existence is up for debate, that certain children are less deserving of care, that certain families don't have the right to make medical decisions, because once you concede that terrain, once you accept that it's legitimate to question whether transgender people deserve access to healthcare, then you've already lost, and the fight we're in right now is about basic human dignity, about bodily autonomy, about whether we're going to be a society that actually values all of its members, or one that sacrifices its most vulnerable to appease the cruelty of its most reactionary elements. And I know which side I'm on, and I know which side history will judge kindly, and I know that decades from now, when people look back on this moment, they will ask, where were you when the federal government declared war on transgender children? And I need you to be able to answer that. You fought, that you resisted, that you didn't look away.